In a Fox 16 health alert, with COVID still putting people in the hospital, they say it's a recipe for the perfect storm. Jessica Rank joins us now in studio. And Jessica, flu season was pretty light last year, so what is going to be different this time around?
Yeah, Cassandra, well, doctors say it has to do with a lot of how our habits have changed. This time last year, a lot of people were still cautious about going out in public because of COVID-19. Now we're seeing more people get back to normal, but doctors say it's too soon to let our guard down completely. Warm days like this are going to be few and far between in the months to come. And as winter creeps closer, doctors are predicting anything but sunshine.
It's a perfect storm, so to speak.
Robert Hopkins is a doctor at UAMS. He says this flu season, the hospital will likely be battling two viruses at once.
We're still dealing with COVID.
Last year was a light flu season. While that helped doctors in 2020, Hopkins says it could be the reason for a busy 2021.
People not being exposed to influenza last year, that our immune protection against flu is going to be less.
He also says more are letting their guard down with COVID, something we weren't quite doing last year, which helps stop the spread of any viruses.
We are seeing people back to more frequent travel. You go out in the community, you rarely see people wearing a mask now.
It has honestly been scary.
Muriel Vaden is 7 months pregnant, and she says she doesn't want to take any chances, rolling up her sleeve for both the COVID and flu vaccine.
It's just extra precautions to keep me safe.
Hopkins is hoping more follow her lead to help prevent what he says could be a twindemic.
You put those two together along with short-staffed and tired staff, and we have the real potential for a problem.
Hopkins says the best way to prevent a bad flu season is to get the vaccine. Live in studio, I'm Jessica Rank for Fox 16 News.